Presentation of the first annual WILO Mental Health Summit. Today's broadcast is also being streamed live at WILOTV.com. Today, we will speak with several area and regional representatives concerning mental health awareness and issues affecting us every day across the state and nation. Today's broadcast is moderated by WILO News Director Ken Hartman and Laura Archibald with Healthy Communities of Clinton County. We hope you enjoyed today's broadcast. The WILO Mental Health Summit is brought to you by Wampler Services, Inc., Encompass Credit Union, and the Clinton County Chamber of Commerce. Now, with some opening thoughts and introductions, here is your moderator for the event, Ken Hartman.
And welcome to the WILO Mental Health Summit. I'm Ken Hartman. The goal of this venture is to give everyone the ways and means to combat this growing problem, as well as give solutions and ideas on handling the issues. This summit is being sponsored by Encompass Credit Union, Wampler Services Incorporated, and the Clinton County Chamber of Commerce. Without these fine sponsors, we would not be able to bring you this event. Also, if anyone wants to submit a question to be asked, they may call 659-3338 and leave that question with the person who answers the phone. Now, introduced by co-host Laura Archibald, who's going to introduce our guests.
Hello, my name is Laura Archibald. I'm the Executive Director at Healthy Communities of Clinton County. We were very picky when we put this panel of people together. We wanted to get people from all walks of life with all different experiences, but you're all here for a reason. You were chosen because you have mental health things that have happened in your life or in lives of people that are around you, and you all have a reason that this is near and dear to your heart. So I'm going to ask that we'll start with Kirsten, and you all introduce yourself and talk a little bit about why mental health is important to you and how it affects your either personal life or professional life or both.
Good morning. I'm Kirsten Clark, and I am the principal at Clinton Prairie Junior Senior High School, and this is my 17th year in public education, and in those 17 years we have seen an increase in issues with our students, with social emotional issues, mental health issues, and this is something that affects us in our building on a daily basis, and we go home at night worrying about our students and their well-being, and we have seen some unfortunate incidents in the last couple of years at Clinton Prairie with deaths of students and suicides, and this is something that we are working hard to try and figure out and to help those kids every day, and sometimes, it is a struggle, and so hopefully I can work with everyone here to get some answers for our students.
Hello, good morning. My name is Casey McGill, and I am the VOCA coordinator at Healthy Communities of Clinton County. My passion in the mental health field would have to be, I'm a recent graduate as of 2 years ago from IUPUI, but in high school, over the past 5 years, I've lost 3 community members, family friends from a mental illness. And that kind of coming back home and having that hit home, I think that kind of drove my passion to get into this field and start helping and supporting and raising awareness in our community about mental health. So that is kind of why I started.
Good morning. I'm Dick Moore, and I'm representing NAMI, National Alliance on Mental Illness. I've been doing volunteer work for NAMI for about 12 years, I think. We were exposed to NAMI through a personal thing. Our son was diagnosed with schizophrenia, and you can imagine our introduction to it was a phone call in the middle of the night from our son who lived out of state, and his wife said he was having he was hearing voices, and you can imagine what our reaction was. We didn't know what was going on, what to do. The whole works was totally new to us. So this put forth a lot of questions and answers, and we immediately went to visit them out of state, and luckily he was through CIT, Crisis Intervention Team. He was talked to and came to understand that he needed to go to a health center there at the university where he was, and that started the whole process as far as getting help at that point. So this pointed out an incident which encouraged us, and we were so thankful for it, as far as being exposed to NAMI. The training we took immediately was the Family to Family, where we learned all about mental illness, what to do, what not to do, the whole works. And this is a deep encouragement for us to walk through the situation he was in. And bottom line, he is doing great now. He finished his master's degree in Spanish and has his degree in computers. And he's presently has a family and lives in Alice State. And so it was just a super experience. He recovered.
My name's Rodney Wan. I'm the administrator of the Clinton County Health Department. I'm here, first of all, from a personal situation and a personal background of I've had experience with mental health issues in my family. I lost my mother 30 years ago to mental health issues. I think, really honestly, whether diagnosed or undiagnosed, most families in America have had to deal with some sort of issue of mental health to some degree or another. And so therefore, I think all of us really need to take a look at how we view mental health issues and how we support and treat others who are dealing with those from a community standpoint. From the county health department standpoint, obviously we deal with trends and statistics on a regular basis, and we see alarming rates of mental health issues in our county. We see a lack of resources through studies and surveys that point out that those resources are not available on a per capita basis to those folks that need it. We also see some associations with self-medication and substance use disorder issues that are now becoming a strong correlation to the issue, and we believe that it's partly because of this lack of resources and lack of availability to those resources that are leading us to this trend. And this trend is a dangerous one that we'll have a large struggle with combating. So from a public health standpoint, I'm here for those reasons as well.
Good morning. I'm Leslie Douglas, and I'm a licensed clinical social worker with the state of Indiana. I am currently the program manager at Community Howard Regional Health here in Clinton County, and I've been in social services since 1988, officially. My mother was a caretaker, so I think that's where I got into it. So I've really been probably in social services since high school, I would guess, but legally and licensed-wise since 1988. I deal with mental health issues on a daily basis with my job. Not only do we have folks who come to our office to seek help, but I also go to the Clinton County Jail for 5 hours a week, and there are significant numbers of individuals at the jail who have mental health issues who probably really should be seeking mental health treatment instead of being incarcerated. I think that since the mid-'50s, when we started to deinstitutionalize mental health treatment, we ended up creating a whole situation where there was the stigma of mental health, as well as we didn't have the resources available for persons to seek services, because all the state hospitals, or vast majority of them, closed across the country. I think that, that has contributed significantly to a lot of the mass shootings, as well as the drug and alcohol issues, because most folks have an underlying mental health issue who get into substance abuse.
Good Good morning, I'm Tammy Cooper, and I'm here on behalf of the Buck Up Foundation. This is a foundation that we actually founded for our son, and he suffered from depression for quite a few years and anxiety disorder, and he took his life. He died by suicide in October of 2016, and we have worked since then to bring awareness to the community, the Clinton County community, as well as the Lafayette community where I work, in the facility that I work in a manufacturing facility. So I see it often on both sides. And, we want to work to bring awareness, stop the stigma associated with it, and let people know that it's okay to talk about it. It's okay to seek help, that it is an illness. It's very near and dear to all of us, and we work daily to do that and bring that awareness to everyone.
Good morning. I'm Jennifer Flora. I'm the Director of Mental Health America, Wabash Valley Region. We're located in Lafayette, Indiana. I have been the director there for 25 years. I've seen a lot of changes in the mental health world as far as treatment as well as stigma and public understanding of mental health issues. With that, we certainly see the need for continued mental health education and services. Mental Health America does provide educational programs and supportive services for both individuals experiencing mental health issues and their families. We know that mental health and mental illness impact virtually every aspect of a person's life. The impact it has cannot be overstated. We know that 1 in 4 families are experiencing mental illness, and my family is no different. We are one of those 1 in 4 families. So I have both a personal and a professional passion for helping those struggling with mental health issues and increasing those services for them.
Okay, we're just going to ask a general questions here and let everybody go around the table. If you want to speak, just go ahead and just grab one of the mics we got out here for you. The question I got here for you is, how big of an overall issue is mental health, and do you feel it's being pushed to the back burner?
I would say that in my professional life in the school, I don't feel like it's being pushed to the back burner. But I think the issue is that a lot of times we don't know what the issue is with students. If there are no outward signs or someone is not seeking help, we can't provide that help. And it feels like sometimes we're being more reactive than proactive because something happens and then we have to figure out where to go from there. So unfortunately, and I think that our counseling department would say the same thing, that we feel like we're more reactive than proactive, but it's difficult for us to know what those issues are if we're not being made aware of them through the student themselves or a faculty member who's noticing some changes or, in their behavior.
I certainly agree that I don't think mental health is being pushed to the back burner. I think it is more out in the open today than it ever has been before. It's on the nightly news. It's in discussions with our coworkers and with our family members and our friends. So it's something that people are more aware of than ever before. The one area that I would say maybe is being pushed to the back burner is that of funding. We know that we have a serious problem with the number of people that are choosing mental health as their career. We do not have enough therapists. We do not have enough counselors. We know for folks wanting to make that a career, it can be a challenge financially. Some of the Medicaid reimbursements are based on 1973 levels, and we know that funding for services needs to be increased if we're going to have quality mental health professionals working in the field, as well as enough professionals working in the field. But as far as everyday conversation, it's right at the top of the list.
I would certainly agree with all the comments that are coming out here. And I think one general comment or conclusion, I think, too, is the fact of how important dealing with mental health conditions is. And I'm reading from a statistic paper here where it talks about among non-communicable diseases, mental health conditions are the leading cause of shortened lifespans worldwide and account for 37% of healthy life years lost. People with mental illness die an average of 25 years earlier than Americans' largely treatable health conditions. And I think this is a valid assumption and a statistic. And I know in my experiences with teaching family to family and being on the board of NAMI out of the Lafayette, West Central District, my conclusion is very strong. We need education on mental illness, mental health. We need to recognize there's still the factor of stigma. We need to fight the stigma thing. I think if we get over that stigma barrier, I think more people would come forward and get help. And one of the key things about treatment of mental illness is that support of family and friends along with professionals. And we need to be working through the schools. We need to be working through at the young age level. We need to be working with individuals. We need to be working with the families. We need to be working with communities. It's a community thing. I mean, because much of the stigma, I think, comes from the community. They're not aware of and don't have the contact with people with mental illness.
Dick, let me ask you, when you said you need to get young people involved, how young of an age are you talking about?
I'd be referencing the fact of at the family level, we need to fight parents. Parents need to be aware of their responsibilities to barrier. I think more people would come forward and get within that family. And one of the key things about treatment of mental illness, in the schools, I think we do have programs now going on where we do have presentations before the schools. I think Clinton Prairie is very active in that area, and others that are taking advantage of that program that's available.
I think, as I alluded in my introduction, the problem with mental health issues has been since there were people, I think. And in the 1950s in America, we decided to deinstitutionalize mental health services, which sounded great, and it also got a lot of people out of some really horrible conditions. However, what it did, especially at least in Indiana, which is what I'm familiar with, in '94, the last of the Central State Hospital closed, as well as several other state hospitals. And because of this, all of those folks who were living in those places were turned out into group homes, and they were turned out onto the street because there was not services. They were, if you will, dumped on the mental health community centers. And most of those people are likely dead or in jail at this point because, they didn't take their medication, and so they became, more mentally ill, or the symptoms increased. And, if you look at statistics, out of the mass shootings that we've had since 1984, 52.3% were definitely by persons who had mental health issues, and if there were an additional 80 or 26 people or cases that weren't clear. So even if all of those, which likely they did, that means that 78.5% of the mass shootings since 1984 have had persons who have mental health issues who are being untreated.
So what are the signs and symptoms of mental illness, and how does someone know when to seek help for themselves or someone that they love?
Well, it depends on the mental illness, what the signs and the symptoms would be. Depression, it could be that they're sleeping more or not sleeping. It could be that they don't have an appetite or they eat too much. It could be, that they have stopped taking care of their appearance. For anxiety, in children, anxiety looks a lot like ADHD. And, historically, we have diagnosed a lot of ADHD and put kids on medications that they likely didn't need because it was an anxiety-based issue. And because literally, if you think about a child who you think has ADHD and they are, wiggling in their seat or they're messing with people's stuff on their desks, that the same kind of thing is going on with a child who's anxious, who has had some sort of trauma in their life. And the trauma could be as simple as not knowing what they were going to have for dinner because there was no food in the house. So for the more common things like the anxiety and depression, it's changes in behavior really. For things like schizophrenia and some of the more the more serious issues would be, somebody alluded to hearing voices. If you're having you yourself or you know someone who's having an entire conversation with themselves, but you only hear half the conversation, or if they tell you that that people are out to get them. I mean, I could probably tell lots and lots of stories here about different things I've heard, but I'll never forget my first experience with somebody who was diagnosed with schizophrenia as a professional. I was sitting in a room interviewing her, just she and I were in the room, and she kept looking behind me. And finally, it made me nervous enough. I looked behind myself, and I asked what she was looking at, and she said, in a whispered voice, "The man." And I said, "What man?" And she said, "That man." And I said, I turned around again and looked and said, "What man?" She said, "The man over in the corner." And I looked again and I said, "So why are we whispering?" She goes, "Because he can hear us." And that was my first real experience where I was like, oh wow, this is real to her. She sees this person. And, it was terrifying to her and a little bit to me as a professional because I was like, I'm okay, I don't know what to do here. So, I think that when it comes to signs and symptoms, there are many, 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 and they can be in opposing areas. Like, like I said, it can be not eating or eating too much, sleeping, not sleeping at all.
So, Tammy, I know that you had a personal experience with your son. Did he exhibit signs and symptoms? And, Dick, your son was out of state, so you probably weren't able to see the signs and symptoms as clearly. But from a personal story, can you address about what signs and symptoms that you were able to see?
Yes, with him, he had very high anxiety, and this all came about his freshman year in college, which is a big change time. So it's hard sometimes to realize, okay, is this because of the change that going into college, being away from home, or is there really something else going on? And just by talking to him, I knew that he was like very high anxiety, wasn't sleeping, wasn't eating. Nothing was making him happy, and he would call, and I just had that gut feeling that something was wrong. So immediately drove there, got him to the doctor, had him diagnosed, and started working through it with a counselor at that point as well with him to make sure that he had everything he needed. And it did get to the point where he did come home in December then, and he stayed home and re-enrolled at Purdue. But that's what we needed to do so that he had, like Dick said, that family support with him. It was critical to be able to support him that way.
And we likewise, with our son having the symptoms, we went to visit and stayed with them quite for a little while. And when we got there, it was a matter of he experienced, well, he said the person above who rented an apartment, she was hacking into his computer and had hidden cameras. And our son was, tearing out the registers in his apartment, trying to find that microphone or whatever. Then later, it was a matter of him like banging on the door of the apartment upstairs and accusing her. And then when you have to do some things, and we called the police, and police came, and then is when the CIT thing kicked in. The police were very trained on CIT. They were able to calm him down, and he agreed to go to sit in a police car and talk, and then from there they went to the University Health Center and got help. And that was just a blessing that it got things started. But things can be real, and it was very traumatic, to say the least.
One thing I'd like to add to your question, if someone is thinking maybe they need mental health services but they're not sure, and that is, it's totally fine to see a therapist and go to a counselor even when you're mentally healthy. We do this with our primary care physicians all the time, and particularly families that may have a significant history of mental illness. I have known that some of these families begin taking their children into a counselor when they're about 15 or 16 years old, just to have that discussion, to set the example of what it's like to talk to a counselor, and that it's okay. So if anyone should be wondering if they should be seeing a therapist, we certainly encourage them to do so.
So like a wellness check like we do for our physical health, but just doing it for our mental health as well.
Absolutely.
And I do think that part of it has to be with the fact of, in one of our classes we had with family to family, they stress quite heavily, mental illness is a biological disease. It's similar, it's a disease like stroke, heart attack. It's a biological disease. Once we get over that understanding, I think we can see things happen. People will come freely, I think, to visit professionals to get help. But right now, I think the stigma is still in the way as far as people seeking help when they really need help.
I kind of wanted to talk a little bit more about the warning signs. I recently finished a training through the American Foundation for Suicide Prevention called ASSIST, and that's Applied Suicide Intervention Skills Training. And with that training, we didn't really talk about warning signs, but more about exploring invitations. And with those is, if you're talking with someone who might have a mental health illness, or you're questioning if they are suicidal, talking with them and really, really listening to what they're saying to you. Are they giving away personal values, items that they possess, they have a lot of value, are they giving those away? Are they talking about maybe going away and not coming back? Or, exploring those invitations and really listening to people when you're talking with them and hearing those invitations, and then listening to their story, finding a turning point in that story and really giving them hope and support and awareness, letting them know that you're there, and then helping them develop a safety plan if they are questioning about killing themselves. That training was really, really helpful in learning how to listen to those invitations and how to act on those in a way that's helpful and supportive.
I just wanted to add a couple things that we sometimes see in the schools for those outward signs and symptoms of withdrawing from their friends. Their attendance rate drops dramatically just because they don't want to come to school. They just don't want to be there. Withdrawing from activities. Their grades are slipping. Those are some of the things that we see at school that tell us, that there may be an issue and that we need to investigate further.
Okay, our next question is going to be, what resources are available in our community and or the area for people suffering from mental illness and their families?
We currently have 2 counseling agencies in the community. Community Howard Regional Health and Wabash Valley. Both have services available in the city of Frankfort. There are significant other services available in the Lafayette, Kokomo areas, even in Lebanon. And we in the community have mental health issues or mental health services available for individuals, families. We have groups available. We have psychiatric care available, where they can prescribe the medications for the various mental illnesses. We have, have a shortage, as was alluded to earlier. There are always room for more therapists and more psychiatrists to join the ranks of helping other people. But some people, I think, have a little bit of a stigma about coming to services in town because they don't want their friends and family to know because of that stigma. And I think that, there are countless services, Lafayette, Kokomo, Indianapolis, Lebanon, so that if people have that concern.
Mental Health America has quite a few services available, which are listed on our website. I will not go into all of those. I would like to mention two of them. One is we do have a 24/7 crisis hotline. People can phone that any time of day or night, and they can also text that number. We know for many junior high and high school students, and we're learning even college students, they would much rather text than talk. The number is 765-742-0244. And again, that is the phone number and the text number. So that service is always available. We also have a new program called Mental Health Navigator Services, and it is a program determined in our community as a community need about a year ago. It is a starting point for people that are trying to find a counselor. A lot of folks just don't know where to turn. They don't know who will accept their insurance, or they don't know who may provide services if they do not have insurance. And entering the mental health care services system can be a real challenge. A lot of people have had barriers. They may make 3 phone calls and find out that no place is even adding names to their wait list. Tippecanoe County and most of our surrounding counties are in an area called a mental health professional shortage area, so we do not have enough service providers. And Mental Health America is certainly working to help get people the services they need. So both our crisis center and our navigator services have been a big help to those seeking services.
Likewise, NAMI has been noted for educational presentations and classes, family to families, one class, peer-to-peer, wellness recovery, and crisis intervention. These can be classes that perhaps meet during or for 11 weeks, 10 weeks. It's a series of classes which provide a lot of certainly good information as far as mental health and mental illness is concerned. Likewise, we have volunteers putting on programs like the NAMI Connection. This is the recovery support group. Family support group also is a similar group. We also have just general information designed to meet a particular audience. And this could be one is who is NAMI? To learn more about what NAMI is doing, and in our own voice, it would be a presentation from a person experiencing mental illness, just talking about her illness and what's involved, what she has gone through. A new one we have is also the stigma-free program, where we're starting to meet with companies. The focusing in on the mental health, mental illness issues that could be seen in the companies or organizations, and helping the companies and with resources and help to eliminate a lot of that, not just the stigma, but helping the situation to make that company more productive when they do see some mental health issues involved. So these are just a few. Another one we've gotten into is we're starting a mentoring program now where we can plug in volunteers to be mentors for ones like the homelessness and ones coming out of jail, ones have they need that help with a person walking beside them to see them through the rough times. And of course, now the big one too is working with the schools. I think with Rossville and Clinton Prairie, they have presentations towards the students, junior high, senior high. Also, presentations for the parents, presentations for the parents and teachers and staff. I think this is so important that they have a background knowledge of what mental health and mental illness really is.
To kind of discuss more about the resources for mental health in Clinton County, with Healthy Communities of Clinton County, our mental health initiative, we host a annual 5K, and this year will be our second year. And that 5K is called Stepping on Stigma, and that is kind of our campaign that we wanted to start here in Clinton County to raise awareness about mental health. And that 5K is a run walk. It's available to anyone and any age. Can come and they can enjoy a day where they can get resources for mental health. They can kind of discuss with professionals that are there. They can get their physical health up and going. That also improves their mental health. We really like to make that connection there, offer resources. We have good prizes, and it's really a fun-packed day and a good way to increase mental health awareness. And this next year, that will be on May 11th, 2019, and it starts at 10 o'clock at the fairgrounds. Another resource that we have been trying to bring to Clinton County and that we have gotten approved is Send Silence Packing, and that is a national event where we have partnered with Active Minds to bring that program into Clinton County. And what Send Silence Packing is where they bring thousands of backpacks of stories that have been provided from family members and community members who have lost someone. And it's that story of that individual. It talks about their warning signs about what happened, how they found support, their families found support after that event had happened. And that Send Silence Packing is going to be coming to Clinton County on May 14th, 2019. It's the weekend right after the 5K. So we've really tried to raise awareness for the month of May, which is Mental Health Awareness Month. But then I know a lot of people are talking about resources that are in Lafayette and in Kokomo and here in Clinton County, but there are so many resources online. Lookup.com is a great resource for schools, for parents, for students. And there's also a bunch of mental health apps like Calm, Headspace, Pacifica, Happify, Breathe to Relax. Those are just some of the many apps that are available for people who suffer from anxiety and depression. If they're having a big presentation where they're really worried, they can sit down 15 minutes before that presentation and do an exercise on that app to help lower their anxiety. Those are just small ways that can help someone who's dealing with the mental health and bring positivity into that.
Also, I forgot to mention one resource thing that's available is this is a published article, published guide, I guess, resource guide to and a roadmap to recovery. This was a guide put together by Healthy Communities, and it does list the helps. It's just super. It covers everything, and it's programs available and crisis chapter in it or part of it, and but this is. I just appreciate the fact that they've gone to the extent of putting all the resources together in this one guide, and I think this is something that would be available, I think, through Healthy Communities, and it's certainly a step in the right direction.
bringing up that resource guide, I know one of the things that was vital is putting substance use disorder programs and support programs for families and mental health programs and resources together. What is that correlation between substance use disorder and mental health?
Often, people who have substance use disorder, it started with mental illness of some sort. There's an underlying depression, there's an underlying anxiety, there's an underlying schizophrenia. Something is there that they're self-medicating for. And that's not 100% of the time, but often it's that connection. I think that, we as humans tend to look for some sort of a medication to deal with all of our problems, whether it be as simple as a headache or it could be, the hearing voices. And so, that it's just the common medical model that we look for some sort of a medication, and frequently that becomes the illegal medications or an illegal use of medications.
I think nowadays, especially with my generation, is if I had a bad day today, if I'm in pain today, I supplement that with alcohol or with drugs, or instead of focusing, I've had a bad day, maybe I should go for a run. It's a lot of, I have this pain, and I need something to diminish that pain. I need something to block that pain. But what we don't realize is that pain may be gone for 5 hours, for however long you've got that buzz for, but it's going to go away, and that pain's going to come back. And there's something else out there that can help deal with that pain that's going to make it a lot easier.
In addition to that, that with that 5 hours, you're right, the pain does go away for just a short time. And it does come back sometimes in triplicate or double minimum, and I think that when you, one question that we have to ask ourselves is how much can we really expect our bodies to have zero pain? It is not realistic to think that a person is never going to have a single pain, just if for no other reason, the lack of care that we take with our physical bodies and what we put them through. I mean, if we expect to have zero pain, then that's what has created kind of our opioid crisis. Is, if we expect to have zero pain, then we want a pill to alleviate that pain. So we have to ask ourselves, what pain level is okay? What can we tolerate versus, what can I take to get rid of all my pain?
Okay, anybody else want to add anything on this particular topic before going to something else? Okay, why do you think suicide rates are at an all-time high?
I think that suicide rates are at an all-time high right now because we have persons who don't know how to cope with their various mental health issues and just life problems. I think that everybody's under a lot of stress and pressure to do, perform, to do well in college, to do well in school, to have that perfect relationship. And I think a lot of it's self-applied pressure or peer-applied pressure, but I think that they haven't been helped and learned so that they learn positive coping skills.
I agree with that, Leslie. To kind of add, I think there's a huge gap between what people think of being physically healthy and then being mentally healthy. There's a large gap because you can see those physical, if I have a broken arm, if I have a black eye, people can see that. But if I'm feeling depressed today, people can't see that. So there's a huge gap between taking that time to really talk and associate yourself with someone's life and how they're feeling that day. There's a huge gap with our whole society in general.
I think that when Leslie said there's a lot of self-inflicted pressure and a lot of peer-inflicted pressure that we can look to, at least in the schools, we see a lot of social media coming into play with the way students feel about themselves. And I feel like, and even as an adult, because I think we can all say we may be guilty of this as well, we are looking at social media as a reality, when in reality, it is not reality. We are seeing individuals, if you will, highlight reel on social media, and then we are comparing that to our individual lives. And I know that our kids are doing that a lot, and they're basing their self-worth on how many likes they get and how many retweets they get and what this person looks like and how I compare myself to them and why am I not making this much money? Why am I not taking the trips that they are? Why is my family not as together as my friend's family? All of these things that we see every day, and we're inundated with it every day because we're on this all the time, kids and adults alike. We can't just say this is a generational thing because we're doing it too, a lot of us. So I think that there is a lot of comparison going on with kids and adults on why my life doesn't look like their life. And I think that's very difficult for them to separate that isn't reality.
I'm going to pipe in from a layperson's perspective on this, that I hear a lot of this going on, and I have concerns on several issues with a lot of the things. We have a lack of resources, as we well admit, but we also realize with stigmatism existing, even if we had a plethora of resources, they might not be being utilized correctly. We have an opportunity as a community to take, as parents, training and opportunities. It used to be when I was a parent of a younger child, we have homeroom mothers and fathers and people coming in, taking an interest in the school. I'd like to challenge those listeners out there today that are parents to come into someone like NAMI or Healthy Communities or some of our others, Mental Health America. Get this training. We can't put the burden on the schools, on the counselors, and on the administrators any longer. We've already spread them too thin, but let's face it, as our principal was mentioning, the schools are a reflection of our society. There are many society in and of itself. We have an opportunity to stop a generational problem at an early age if we can get resources there now. And some of those resources can be as simple as community leaders and community individuals taking training, being in the schools to add to the individuals who are looking out for those children who are exhibiting the signs and symptoms we're talking about, reaching out. I think as a society, if you want to remove stigmatism, start caring about everybody that you run into and that you interact with every day. The signs are there, but many a times we're too stressed, we're too busy with our own lives that we don't really, I heard that, it sounded kind of funny, but I'm going to put it off here in the back of my mind until I hear a shocking reality that something terrible has happened. And we had that opportunity to intervene then, but we need the skill sets, we need the training, we need the compassion in order to be able to do that, I believe.
And I would certainly agree with that. I know in some of the statistics, we'll talk about today, 1 in 10 children and youth experiences mental illness conditions severe enough to cause significant impairment in their day-to-day lives. Without appropriate treatment, youth struggle with peer and family relationships, drop out of school, become entangled in the juvenile justice system, or most tragically, die by suicide. But let's take a brief look at another area of suicide. Mental disorders, signature injuries of the wars in Iraq and Afghanistan affect 1 in 5 active duty service members and are the most common cause of hospitalization. Military suicide is a national crisis with one active duty soldier taking his or her own life every 36 hours, and one veteran every 80 minutes. And so as Rodney said, pull alongside these people who experience these things or see these things. They need help. Don't shy away from it as far as a stigma standpoint. It's a sickness, it's an illness, it's a need. There's a need there for all of us as a community to be aware of what mental health, mental illness is, and be active to stamp out the stigma.
I would also say that, when we're walking alongside each other, you need to check on your friends that are down, but you also need to check on your friends that seem okay and that are happy and that are successful. But we always need to check in with each other, because you don't know what goes on besides what you see in that facade every day. And so we do need to walk alongside each other. I like the way that you said that, and check in with each other. And the people that work in my school, my colleagues, we have to worry about each other too, because those kids are our kids. Those 555 junior, senior high kids, those are all our kids. And when we're so concerned about them, then we get to a point where we're run down as well. So I worry about the kids, and I worry about the teachers, and I worry about the counselors and the nurse and the administrative team. And so we all have to look out for each other.
I'd just like to add that if someone listening is having thoughts of suicide, to reach out to someone, reach out to an adult, reach out to someone close to you, let them know what you're going through. If you feel like they're not listening, try reaching out to someone else. There is someone out there that will listen. You can always call the National Suicide Prevention Lifeline. They have excellent counselors on staff that can help. Again, we have our own local crisis center that is available 24/7. But if you're having, whether it's mental health issues, financial issues, relationship issues, let someone know, because there are people here that care about you, and there are people that want to help.
Okay, we're going to go ahead and take a break. We'll have more of the Mental Health Summit after the break.
Over 60 years, your home for classic hits. 1570 AM and 96.9 FM. WILO. WILO. Frankfurt.
We hope you're enjoying today's broadcast of the WILO Mental Health Summit. Approximately 1 in 5 adults in the U.S., 43.8 million or 18.5%, experiences mental illness in a given year. Approximately 1 in 25 adults in the U.S., 9.8 million or 4.0%, experiences a serious mental illness in a given year that substantially interferes with or limits one or more major life activities. Approximately 1 in 5 youth aged 13 to 18 or 21% experiences a severe mental disorder at some point during their life. For children aged 8 to 15, the estimate is 13%. 2.6% of adults in the U.S. live with bipolar disorder. 6.9% of adults in the U.S., or 16 million, had at least one major depressive episode in the past year. 18.1% of adults in the U.S. experienced an anxiety disorder, such as post-traumatic stress disorder and specific phobias. Among the 20.2 million adults in the U.S. who experienced a substance use disorder, or 50%, or 10.2 million adults, had a co-occurring mental illness. Here's some social stats. An estimated 26% of homeless adults staying in shelters live with severe mental illness and or substance use disorders. Approximately 20% of state prisoners and 21% of local jail prisoners have a recent history of mental health conditions. 70% of youth in juvenile justice systems have at least one mental health condition, and at least 20% live with a serious mental illness. Only 41% of adults in the U.S. with a mental health condition received mental health services in the past year. Among adults with serious mental illness, 62.9% received mental health services in the past year. Just over half, or 50.6% of children with a mental health condition aged 8 to 15 received mental health services in the previous year. African Americans and Hispanic Americans each use mental health services at about 1/2 the rate of Caucasian Americans, and Asian Americans at about 1/3 the rate. Half of all chronic mental illness begins by age 14, 3/4 by age 24. Despite effective treatment, there are long delays, sometimes decades, between the first appearance of symptoms and when people actually get help. Serious mental illness costs America $193.2 billion in lost earnings per year. Mood disorders, including major depression, rhythmic disorder, and bipolar disorder, are the third most common cause of hospitalization in the U.S. for both youth and adults aged 18 to 44.
WILO.
Let's rejoin Ken Hartman and Laura Archibald for more of the Mental Health Summit on WILO. Special thanks to our sponsors, Wampler Services, Inc., Encompass Credit Union, and the Clinton County Chamber of Commerce. Now here's Ken Hartman.
Okay, welcome back to the Mental Health Summit. I'm Ken Hartman. I'm being joined by Laura Archibald. We have a great panel here. We're going to continue our Mental Health Summit with a question from Laura.
So we hear frequently and have heard this morning about trauma and adverse childhood experiences. We know that that is something that continues to be an issue. You probably see it at the schools a lot, but also in your practices. So how does trauma and adverse childhood experiences affect people's mental health?
So I recently attended the Indiana Youth Institute's Kids Count conference, and that was a 2-day jam-packed conference where I learned so much about ACEs and how ACEs are adverse childhood experiences, and how when a child experiences one ACE, that can impact their schoolwork, that can impact their mental health, that can impact their regular day-to-day activities, getting up and just going to school. But I also learned that many children not just have one ACE, but they have so many ACEs. And the more ACEs that they have, the more detrimental that can be on their physical health and their mental health.
So obviously, I'm not a mental health professional, but I know that the kids, when they come through the door every morning, they're bringing their baggage with them, as they come through the door, and it's hard for them to leave that outside. And so whatever's happening at home is carrying over to school. And like Casey said, it can affect their grades, it can affect their attendance. And so while I don't know, professionally what all of that means and how that transfers, I see it on a daily basis.
The experiences we have as a child affect us the rest of our lives. It's that shapes our perceptions of things, that shapes how we see the world, and then how we learn to deal with it and how we were supported through those adverse events and those traumas. That also affects how we see the world and whether the world's a safe place or not. If we as a child had lived in a violent home, then that's going to affect how they experience the world. They will be fretful. They may be mistrustful. They aren't sure if they hear a loud noise, if that means that there's a plate coming toward their head or anything similar like that.
At Healthy Communities of Clinton County, we partner with Quinton's House, and Quinton's House is a child advocacy center, and there I am a child advocate to all of the children who go to get interviews there, and mainly all of the children that go they do have one ACE, if not more than one ACE. And I've only been there about 2 months, but the 2 months I have been there, I've heard of stories of where children have experienced sexual abuse at a young age. They are not able to, something as simple as, going to the bathroom is difficult for them because they've experienced something like that. And that's going to be with that child till the day that they die. And it's extremely important to address the mental health aspect to children who do experience ACEs, because it does have a strong impact later on in life, and to our work benefits, our community, their children, their families. Yeah.
Okay, our next question is, how do we raise resilient youth, and why do you think they're more susceptible to things such as this?
I'll tackle the first half of that. How do we raise resilient youth? We listen to them, we love them, we accept whatever it is they bring, we teach them problem-solving skills, we let them fail. We need children to learn that not everybody is going to win all the time. There are people who, there are teams that win. There are people who get different raises in life because of their performance. And because when a child understands that failure is a part of life and they learn how to deal with it, that's a coping skill they've developed.
I know that Healthy Communities has been partnering with some of the county schools. North Central Health just released a youth resiliency planning grant, and we helped community schools of Frankfort, Clinton Central, and Clinton Prairie write that grant. Kirsten, do you want to talk a little bit about why it's important that the schools have the skills to teach kids resiliency?
First of all, thank you for helping us with that grant. And we have had Healthy Communities in our school for multiple reasons, multiple ways that they're helping us, and we greatly appreciate all that you do for us. I would say, Leslie, everything that Leslie said about raising resilient kids is absolutely true. While we, some of us are parents, I'm a parent, I know it's difficult sometimes when your child is facing adversity or losing or struggling in a class, but those are things that as parents we have to talk about those things, and we have to explain, this is going to happen, and now what are you going to do to overcome that adversity? As far as the schools, we are looking through this grant at different curriculums to bring into the school to help with exactly those kinds of things and the social, emotional well-being of our students and how we can help with those things. And we obviously are in education because we care about kids, but we don't have all the answers. And we are sometimes struggling to find ways to help. And these kinds of grants that these corporations are providing are so beneficial for us to be able to do that, to be able to go out and look at those curriculums and know, what's going to work specifically for our school, because what's going to work for Clinton Prairie isn't necessarily going to work for even, Frankfort down the road, because we have different demographics and different kids and different situations. And so to have that sort of curriculum to bring into for our specific students is going to be huge for us to be able to move forward in helping our kids. Our counselors, we have 2 counselors right now for 550 kids, and it does become very overwhelming for them to try to do everything that they can, but we are not equipped for the types of help that a lot of our students are in need of right now. And so these kinds of initiatives and grants are going to help us better serve our students, and we still won't have all the answers. We're never going to have all the answers, and we're always going to need help from our outside organizations, but this is going to make it a little bit easier for us.
I would like to add to that, if your child's teacher or your child's school counselor or your child's principal or, your child's mentor, anybody reaches out to you as a parent and says, hey, I think your child could benefit from seeing a mental health professional, please listen to them. Please listen to them, because they spend, in some cases, more time with your child than unfortunately, as a parent, you do. But they see the things that are going on with your child. They know what they're saying, how they're acting, during the course of the school day where they may be hiding it from you. Please listen, help, and don't worry about the stigma that somebody's going to say, oh my gosh, they had to go to counseling. Please get that help for your child.
I think another thing also we need to talk about is as far as the answer being, certainly it's good parenting to meet the physical and the spiritual needs of individuals. particularly kids. They need that spiritual foundation as well for a direction, I think. One thing, too, I think is a solution to the problem is social media. We need to take advantage of opportunities to get the word out to everybody through social media, the radio, newspapers, meetings coming up, just general information that would be helpful for those reading or not directly connected with an agency or organization. But there's that availability on a regular basis through the newspapers or radio to have little things that can help those parents or whoever with the needs of the day.
To add on to what Dick said, how do we raise resilient youth? And through my QPR training, which is question, persuade, refer, they taught us to address protective factors and risk factors. So we need to increase our protective factors, our services in the community, offer support for the families, education for the families and for the schools, and then lowering those risk factors, so gang usage, domestic violence, lowering all those risk factors that may impact mental health. But something at Healthy Communities of Clinton County that we've been doing is we have partnered with a nonprofit called Comfort Cases, and those are a trauma kit or a backpack filled with goodies for individual children who are impacted by ACEs or by needing to be placed into a foster home. So that's one way that we've been trying to raise resilience. And another way is partnering with Clinton Prairies. We've been able to do partner with another nonprofit called See Your Strength, where we have been able to get mirror decals. So their whole school is going to be jam-packed with positive messages in the mirrors on all the bathrooms. And another thing that we have been doing with we have received a grant through the IU grant. The IU Health Foundation gave us a grant, and we are partnering with the Learning Network, Healthy Communities, and Open Door to educate providers in the community, to provide community awareness, and to provide a screening tool using the PHQ-9, and we're going to be using that screening tool to give to all medical professionals. So, when you go to the doctor and you do your regular checkup, they ask, how's your diet? How are you sleeping? When's your last period? They ask you all those questions, but they don't ask you, how's your mental state? Are you feeling anxiety today? How's the last month been sleeping-wise? Digging more deeper into those questions, so that we can have a better picture of their mental health. I think that that's lacking in the medical field, so we're bringing that in and trying to increase the screening tools and resources so that if someone, a medical provider, sees that they have an issue, they can use that tool and refer them to someone in our community.
I think that we have talked a little bit about the relationship between mental health, suicide, and social media. But I wonder about the digital world in general. Video games, social media, apps on phones, all of those things. What way can we use those for the positive, and what ways do you think those affect our youth in particular, but like Kirsten said, everyone, in a negative way?
I'll start out with that. I think obviously it's a tool, and like any tool, some of those can be misused and can have harmful effects, or they can have positive effects. On the positive side, now more than ever, you can reach out to a friend or a relative or a coworker and at least check on them. As you stated earlier, some folks prefer texts. I know I have some of my family that you call and they won't answer, but you text and you get an immediate response. Everyone's different. You can use that tool for good. And along with that, resilience of the children. Where are your values as a community and as a society nowadays? The digital age, all the additional stress, all the additional distractions, they can be a great deterrent. We don't even know what, and I'm coming from the public health side of things now, we don't even know what the impacts of all these devices are going to be 20, 25, 30 years of use down the road from now. We might find that there's some horrid side effects of all of these. So we really need to consider, again, those type of devices too, I think, lead to people being more isolated than they've ever been before in life. And as I think any of us, me being a lay individual, can agree, isolation leads to things that folks that are not healthy as far as thought processes go. We are a societal people. We are in communities for a reason. There are always exceptions to the rule, but for the greater part, we're all that way. And I think that this digital age has led to a lot of that. I think there's still opportunities, like have been mentioned, to use it for good, to combat it. But on the larger scale, we really need to worry and look at it from a societal standpoint. Do we want our kids just playing video games all the time when they're off from school, or do we want them doing the things that are out, are healthy, that they're moving, that we don't see these off products from not having any activity, like unhealthy and obesity and diabetes at a young age? These are things we need to really look at as correlated together in society.
I think one thing we need to touch base on is the fact of, I know we've experienced nationwide terrorists and resulting catastrophic things. I know we have legislatures and politicians and others talking about solving some of those. They may talk only about doing away with certain guns. Well, okay, but I'd like to see, in those cases, drill down through the events of an individual, what has led him to be where he is now. And I think it's going to tell you that the real problem is at a lower level, and that needs to be addressed from a political standpoint and from a legislative standpoint, to get more people involved in the treatment, the counseling, where it really needs to be initiated and started as far as something really effective. But I realize it takes legislature, but I think it's also going to take us to emphasize to those people who have the power to put money where it should be put, wherever that may be. I think there's great opportunity in that area.
Someone said this to me the other day, and it just kind of rang a bell in my head, where bullying doesn't stop when you get off the bus now. And it just was like, wow. When I was younger, you know, I had a phone, but it was only for calling. I didn't have Instagram, I didn't have Twitter, I didn't have DMing. You had to, you know, crank up the computer to do any of that. And I had so many sports I was in, I didn't have time to do that. So I just think nowadays when kids, they get off the bus, that all of that baggage from school and that bullying from school, it follows them right home to all the other baggage that they might have at home too. So it's just a constant wheel that kids are dealing with. And one of the things that Healthy Communities has been doing with the IU grant that we got is bringing Sources of Strength, which is a school program, into the schools, where we are working with youth councils and local SAD groups to kind of bring awareness into the schools.
This may be branching off a little bit, but anyone who's had a toddler, I'm going to talk about the 5 whys. And so, you know, a toddler, you know, can I have this? No. Why? Because you don't need it. Why? Why? I think that is something that we need to use with our kids as they grow older, too. How is school? Fine. You know, like you said, drill down with everybody. How was it? What did you do? If it was awful, why was it awful? Because of this class. Why? You got to not just take their one-word responses and move on. You know, my son, how was school? Fine. And he's in my school. So now I'm going to ask, how was this class? How was this class? What did Mr. Hilgedeek say? What did Mrs. Saban say? You know, but don't just take a one-word response from your kids and find out what is going on a daily basis. And the social media is infiltrating into their school day. People are mean. You know, kids are mean. They're going to be mean. They're going to say things on social media that they wouldn't say to your face. It is very easy to get behind a keyboard or a phone and type anything you want and think nothing's going to happen from that. But we do see it on a daily basis, and it has added a whole nother level to what we do as a school administration. So, and ask your kids about their social media and check their social media and have their passwords and know what they're posting and what they're looking at and who they're talking to. And it can be a very scary thing.
Okay, if anybody wants to have any questions for our panelists here, you can call 659-3338 and we'll get that on for you as soon as possible. I'd also like to thank our sponsors for this, which are Encompass Credit Union, Wampler Services Incorporated, and the Clinton County Chamber of Commerce. Question now is, where do we go from here moving forward?
Again, we as a society need to recognize that mental health issues are a biological illness, just like cancer or just like diabetes, and there are ways to treat these just like those other illnesses that we accept on a daily basis. Without getting too political, we need our elected officials to understand mental illness and to value treatment of mental illness just as they do treatment of those other biological diseases. We need to put resources into mental health care so that we can decrease the number of mass shootings or the number of kids and adults committing suicide because of the fact that they have been bullied. And that's adults too. Adults get bullied. It's not just kids. And as they've said, those with your phones and computers, that bullying continues right into your bedroom, as you try to go to sleep at night.
Something that I think, where do we go moving forward is bringing more community education into the community. And that's something that we've been trying to do here at Healthy Communities with our Stepping on Stigma campaign. Bringing trainings, offering a place for people who need resources. They can come to our office and they can ask us a question. We can dive into all of the resources available nationally, federally, in the state of Indiana and in our community in general. But then also volunteering. I think that it's great for everyone to get up and be involved in your community. Know your neighbor. Know the parents that go to your child's school. Have that relationship, because when we have those relationships, it improves our mental health because we know we have support in all those areas. And then lastly is bringing more support and just listening more.
We need to also pay mental health professionals, just like teachers, a living wage. Teachers have fought for it and have gotten better pay over the years, not what they deserve by any chance, but mental health professionals are some of the lowest paid professionals who have, bare minimum 6 years of college and graduate school.
I would say that, again, providing more resources is always needed, but like we've said here, that a lot of this is going to begin at home, and listen to your kids. Listen, if you ask a question, really listen to what they're telling you. We have, at Clinton Prairie, on January 22nd, we are having a full day with a national speaker, Jeff Yalden. He is coming in to address our student body in the morning, and then he will be meeting with teachers. He will be at school all day for everyone who wants to talk to him. He will be meeting with teachers after school, and then we are having a community event that evening, I believe at 6 p.m. So, come out and listen to Jeff Yalden. He is a renowned speaker. He's going to be talking to our kids and our staff about the things that we've talked about today, and mental health, and how to deal with tough situations in life, and traumas, and suicide prevention. And so we are looking forward to hosting him. So I would encourage you to come with your kids. If your kids go to Clinton Prairie, they're going to see it in the morning. Come back in the evening with them and listen to him again.
Very good. words of wisdom. One thing I might mention also, we have a daughter who lives out of state, and she's a social worker, and she investigates reports of child abuse. And there is an area where additional funding, as far as monetary means, it's a very tough type of social work, and but there's so much need of it, because I think where she works, there's a backlog, and there's just not that many applicants to get into the area. But certainly it's challenging. My daughter really enjoys it. There's time of laughter, time of tears, particularly if you have to take kids out of the home and so forth. And but it's a work that's important. It has to be. There's work that needs to be done, and the funding should readily be available for like state agencies and through legislature and whatever to provide that service, which is very much needed.
To follow up just briefly on what Dick said and what others have said here, I like your idea of volunteering as a way of taking that next step. It is so very important. I like your idea of listening, because quite often we listen with the intent to respond, and it's so very important to listen with the intent of trying to understand how someone is thinking. Those are sort of two different kinds of listening skills. I know in the Lafayette area we have done a lot, and we've made a great progress in tackling some of the mental health issues, but the reality does kick in. In our community, we simply can't do a whole lot more without some of the state and national policies taking a change. And part of that is increasing both insurance rates as well as Medicaid rates. We should be embarrassed that we are trying to operate a system with 1973 wages. And we need to be providing possibly some creative solutions to a lot of the mental health professional shortage. Maybe some sort of college loan reimbursement for folks that do go into this area. There's a lot of challenges out there, and local communities can do a lot. Families can do a lot. But it takes all of us, and we need some of those funding issues to actively be addressed.
Real quickly, I think moving forward, I think what we need to realize is this is a real situation. It is happening now. It's generational in some cases. The time to act is now. We need to do something about this now in order to stave off what we are going to for sure see are bigger issues in the past. If you're one of the 1% out there that somehow think that this doesn't affect or bother you in any way, I think we've heard from several individuals here, it is costing us as taxpayers as well. Those funds are unfortunately being directed at incarceration and other areas where they could be being utilized to bring these resources that we're talking about to the communities now. So I think, again, we should empower ourselves as communities to realize this, start to talk to our civil leaders and see about getting something done to turn this trend around.
We have a question from a caller. Is not having enough money in a family home to provide for children the major cause of mental health problems?
I would say it's not the major cause. It can influence it. It can affect a mental health problem, but often a mental health problem is, as we've said before, is biological. There's a chemical imbalance in the brain that causes depression or that causes, schizophrenia, those kinds of things.
I totally agree. We also know that children that grow up with ongoing pervasive stress have a higher rate of mental illness as adults. Some of that can result in the ACEs, the adverse childhood experiences that kids experience. So again, not the major cause of mental illness, but it does play a role, as do many things.
One thing I want to point out, I think that maybe sometimes this gets lost in the message, is that while adverse childhood experiences and trauma definitely impacts people's mental health, there are people out there who struggle with mental illness who have been raised in wonderful homes with wonderful parents who have not experienced a lot of adverse childhood experiences. And that leads you to definitely know that this is an illness. It is a biological condition that people suffer from. All of those other things contribute, but there are still people out there who have wonderful childhoods and don't experience a lot of trauma who still suffer from mental illness. That should tell you how it is a biological condition. It is a science of the brain.
Okay, this is going to be the last question. We're going to wrap this up after this, and I'm going to let's go around the table here. If anybody's got any closing comments or things they want to say, here's the time to go ahead and let it go.
I just, excuse me, I just like to take a minute to thank you for sponsoring this program. I think this is very significant, and I encourage people that are listening to this to talk about it. Talk about it with their family, their friends. Bring mental health issues even further out into the public discussion, and not to turn the other way. To be able to embrace everyone despite what they may be experiencing, and to let them know that they're important, and again, there are people here that care about you.
We are 2.5 days away from Christmas break in our schools, and while the majority of us look forward to those 2 weeks off, we need to remember that there are some of our students who are not looking forward to those 2 weeks off, and I just would hope that everyone in our community would remember those who are less fortunate and who are struggling with mental illness or in any other sort of issue at home, and know that just because we don't have all the resources we need, that we do have resources in our community to help coach kids, Boys and Girls Club, the YMCA, your churches, your schools, to just know that our students in this entire community need everyone in this entire community to have their back.
Okay, I just want to remind everybody that this program is being videotaped, and it will be archived and available on WILOTV.com for anybody at any point in time if they want to go back and watch this. I appreciate everybody that's been out here. I think there's been a very good discussion on this. I appreciate all your time and effort, and we'll see you guys down the road, and everybody take care. We'll see you later.
You've been listening to a special Casper Media presentation of the first annual WILO Mental Health Summit. Today's broadcast is also archived for your viewing playback anytime worldwide at WILOTV.com. The program will be played back in its entirety tonight starting at 5:30 p.m. on WILO. WILO wishes to thank those who participated in today's event, and special thanks to our sponsors, Wampler Services, Inc., Encompass Credit Union, and the Clinton County Chamber of Commerce. The WILO Mental Health Summit is a production of Casper Media.